Hi friends, welcome to classes by Lab Doctor. I am Dr. Divya, and in today's class, let us start with a discussion on sodium in the serum. So you all know that sodium is a electrolyte. An electrolyte nothing but an electrically charged ion. Okay, so this electrolyte is very important in our body because it does many functions. It maintains the water balance, it maintains the acid base balance, it improves the nerve conductivity, muscle contraction, relaxation, etc. So this electrolyte sodium is a very important electrolyte. When do they do this serum electrolyte test? So usually this serum electrolyte, which includes sodium, potassium, chloride, usually it is done as a basic panel, or like in a kidney function test that is usually included. Or suppose if the patient is in ICU, we are monitoring the patient, we do this sodium test. Suppose if there is an acid base imbalance, doctor orders this kind of a test. Suppose patient has vomiting, diarrhea, he is having confusion, tiredness, his heartbeat is decreased. Doctor orders this serum electrolytes, especially we monitor these electrolytes. So sodium is distributed around 50% in the bone. So the remaining 40% of sodium is in the extracellular fluid and the 10% is in the soft tissue. So absorption of the sodium, mainly it happens in the stomach, in the intestine, the colon. And in case of diarrhea, you'll see that lot of sodium is excreted through the feces. Usually less than 2% of sodium is excreted in the feces. So when the patient is having diarrhea, too much of sodium is lost in the feces or stools. So the excretion of the sodium is mainly the function of the kidney. Kidneys will absorb around 99% of this sodium, and if there is an excess sodium, these kidneys will excrete it. This function is controlled by the hormone aldosterone. So I have told you the absorption of the sodium occurs in the small intestine and the colon, and the proximal tubules are the one which absorb 80% of the sodium, while the distal tubules will absorb the remaining 20%. And how it is regulated? The kidney maintains the sodium balance in the body by reabsorbing the percentage of sodium which is filtered by this glomeruli, by the renin-angiotensin system. So whenever there is reduction in the blood volume because of dehydration, vomiting, etc., it will stimulate the renin system, and that will stimulate the angiotensin, and that will help in the production of aldosterone. So what does this aldosterone do? Aldosterone will reabsorb more and more sodium. So wherever there is sodium, there will be water. So the blood volume will expand. So this is regulated by this renin, angiotensin, aldosterone system. So I've told you the sodium absorption, mainly 80% occurs in the proximal tubule and the remaining 20% occurs in the distal convoluted tubule, and the excess sodium is excreted by the kidney. So whenever there is kidney problem, chronic kidney disease, diabetic kidney, kidney damage due to BP, there is an imbalance in the electrolytes because its absorption, the excretion of excess electrolytes, all is done by the kidneys. So to assess the kidney function, electrolytes are one of the important parameter. So now in the distribution of intracellular and extracellular fluid, I have told you that sodium is mainly extracellular. So this sodium is distributed in the intravascular, interstitial, mainly in the interstitial spaces, and also in the transcellular spaces. Main function of this sodium is it maintains the acid base balance. Our blood has a pH of 7.35 to 7.45. So this is a range. It is mostly alkaline. So whenever there is disturbance of this acid base balance, there are a lot of problems in the body, and this acid base balance is due to a balance between the carbonic acids and the bicarbonates. So this carbonic acid and the bicarbonates are all maintained by the electrolytes in our body. You can see the sodium here. So losing too much of the water from the body can lead to increase in the blood pH, because it also causes the loss of blood electrolytes including sodium and potassium. So like you have vomiting, sweating, excessive sweating, diarrhea. All this will causes the change in the body fluids. It causes the change in the electrolytes, and this will lead to changes in the blood pH. So to maintain the blood pH between 7.35 to 7.45, we need electrolytes. Sodium also plays an important role in the contraction as well as the relaxation of the muscles. So don't think it is only the skeletal muscular system, also the movement of the digestive muscles. So it also helps in the peristalsis. It helps us to walk, it helps us to talk, it helps us to move, it helps us to run. So sodium is very important in the muscle contraction as well as relaxation, because it maintains the muscle irritability, cell permeability, etc. When there is loss of sodium, that is why you get lot of muscle cramps, you get muscle pain, you get fatigue. All these things are because there is less sodium to maintain the muscular function. Sodium also has an important role to play to maintain the heart health. So when you see that when you eat more of a sodium, you will have more of water, because sodium attracts water. So your blood pressure will increase. This will make your heart to work harder. So this will put a strain on your heart, and that can cause heart failure. So increased sodium, increased water, increased blood volume, increased blood pressure, and strain on the heart. So this also affects your nervous function. It helps your muscles to contract and relax. That is why the imbalance in sodium can cause arrhythmia, it can cause tachycardia, it can cause bradycardia. So all these action potentials, what you see, they are generated by these electrolytes like sodium, calcium, potassium, etc. Sodium is necessary for initiating and maintaining the heartbeat. So any disturbance in the electrolytes, especially sodium, it can cause changes in your heart. Sodium also maintains the osmotic pressure and the fluid balance. In the later classes, we will study in detail about the fluid balance in our body. But remember, sodium is mainly located in the extracellular compartment, and this sodium will affect the water balance by hydrostatic pressure, osmotic pressure, by maintaining the osmolality, etc. So sodium also helps in the absorption of glucose and the galactose with the help of sodium glucose linked transporters, SGLT1. Here you can see how it is helping the absorption of this glucose and galactose. So this intestinal absorption of glucose and galactose also is dependent upon this sodium, like the sodium glucose co-transporter. So any deficiency of sodium can lead to imbalance in the absorption of this glucose and galactose, and then the energy levels. What are the sources of sodium? What are the good sources of sodium? So sodium is usually found in the salt. So sodium is also found in breads, it is found in whole grains, it is found in leafy vegetables, nuts, eggs, milk. So these are the good sources of sodium. And the major source of sodium is NaCl, or the sodium chloride, or our salt. So World Health Organization says that the adult should consume less than 200 milligram of sodium per day, which is less than 5 grams of salt per day. That is less than 1 teaspoon of salt should be consumed. We should not add it extra. So whatever the salt is used in cooking, that should be sufficient. So that will come up to 1 teaspoon or less than 5 grams of salt per day. Suppose if the patient is having blood pressure, should not consume more than 1500 milligram of sodium per day. And if the patient is having other health condition like kidney failure, liver cirrhosis, heart failure, then also the consumption of sodium will change. Also, the requirement of sodium changes in children and infants. So this is the WHO recommendation of sodium. Normal range of sodium is between 135 to 145 milliequivalents per liter. So this is the normal range. Suppose if the sodium level falls to less than 120 milliequivalent per liter, that is hyponatremia, severe form of hyponatremia, that is a critical stage. So this is the critical value. If the sodium level falls to less than 120 milliequivalents per liter, you are supposed to inform the clinician. So that is a critical level. Suppose if the value of sodium goes more than 160, 170 milliequivalent per liter, that is hypernatremia, that is a critical value. This value needs to be informed to the clinician. So the normal range is between 135 to 145 milliequivalents per liter. Anything less than 135 milliequivalents per liter is called as hyponatremia. Hypernatremia is more sodium, more than 145 milliequivalents per liter. So that is all about the sodium electrolyte in our body. In the further classes, we will discuss more about hyponatremia, hypernatremia, the relationship between sodium and water, osmolarity, etc. Thank you for watching the video. Please like, share and subscribe the channel. Thank you.